Yeah, in our study we showed an association between RASi use, meaning both ACE inhibitors and ERB, and prognosis in patients with heart failure with reduced ejection fraction and age more than 80 years. And in particular, we showed roughly 20% reduction in risk of mortality and even a reduction in risk in mortality or heart failure hospitalization. These results were comparable to the cohort of patients with age equal or less than 80 years in the Swedish heart failure registry. Yeah, currently, heart failure guidelines suggest the use of RASi in patients with HFrEF regardless of age. However, there is the age more than 80 years has not been really investigated in clinical trials, so this recommendation is not based on strong evidence in the elderly group. That's why we perform this analysis. This was an observational study, a propensity score matched analysis performed in the Swedish Heart Failure Registry. So currently we perform analysis in the overall elderly population in the Swedish HF, and then after that we perform a propensity score matched analysis in order to try to have less impact of confounders on our analysis. These data show us that it should be safe to use RASi in elderly population, because at least these drugs do not increase the risk of mortality, since our study shows a reduction in mortality in patients using these drugs. But it also opens to randomized controlled trials in this setting, since our was an observational study and it needs to be confirmed in a randomized setting.